Antibiotics are only used for bacterial infections. And since your sore throat is most likely caused by a viral infection, prescribing antibiotics would only expose you to medication you don't need. In fact, it could harm you. Many of our antibiotics have side effects, such as upset stomach or diarrhea.
But what if you're wrong? I mean, no test is perfect. I don't really want to have to call and make another appointment to come in or go to the emergency room.
I do think it's important that we stay in touch. I also think that your symptoms will slowly get better over the next week or two. If the symptoms get worse, if you have difficulty swallowing, if you have a change in voice, or you have fever over 101, please call the clinic right away. However, I do want to reassure you that I think the odds of this happening are very, very low. There are many things out there that can provide you with some relief from your symptoms. I can give you a list of over-the-counter remedies that will make you feel better.
This is just unacceptable. I'm sick. I need antibiotics. Why can't you just give me antibiotics?
I do not think that antibiotics will make you feel better, and I think we run the risk of exposing you to side effects like diarrhea, even a rash. But there's a bigger issue. Antibiotics are life-saving medications, and we have to use them wisely. If we continue to hand out antibiotics to people who don't need them, we run the risk of not being able to treat bacterial infections. You've heard of superbugs. They become more and more resistant to antibiotics, and the drug companies aren't able to produce new antibiotics quickly enough. We will soon be faced with infections that we aren't able to treat.
Well, I don't see that as an issue for me because I don't use them that often.